Welcome to Women Beyond Borders podcast. Our guest today is someone whose career has touched global health, moral courage, scientific integrity, and the future of medical ethics. Today, we are joined by Dr. Grady, Chief of the Department of Bioethics at the National Institute of Health Clinical Center, one of the most influential voices in clinical ethics worldwide. She has served on the Presidential Commission for the Study of Bioethical Issues, is an elected member of the National Academy of Medicine, a senior researcher fellow at the Kennedy Institute of Ethics, and has received countless awards, including the Lifetime Achievement Award from the American Society for Bioethics. Dr. Grady, thank you so much for joining Women Beyond Borders.
Thank you very much for having me.
When you look back at your journey from nursing to philosophy to leading one of the world's most important bioethics departments, what originally drew you into this work?
I was working as a nurse for a long time after I graduated from college and had an array of very interesting, very challenging jobs that taught me a lot about how to take care of people and how to think about health, but also raised a number of questions about how to take care of people and how to think about health and how to think about healthcare. And at the time, I certainly didn't think of them all as ethical questions, although subsequently I think most of them were. And I decided at some point that I needed more knowledge or some way to think about some of the questions that were plaguing me, that I could address and answer and, feel like I understood better. And so I decided to go back to school and got a PhD in philosophy. And philosophy, it was a degree in philosophy, so it was metaphysics, epistemology, and ethics, but my interests were specifically the ethics of healthcare and biomedical research and public health. So that's how I got there. And I just happened to be very fortunate in terms of being in the right place at the right time at certain times in my life. So when I had, as I mentioned, I had many different jobs as a nurse, both in this country and outside of this country, and then ended up at the NIH early in the HIV epidemic. And many ethical issues were, presented to us in those days. When I decided to do my PhD, I was already in Washington. I continued to work at the NIH and went to school at Georgetown, which is very close to here, so I didn't have to move. And then when I finished my PhD, I was still at the NIH, and it just happened to be at the time that the then director of the clinical center, which is the hospital at the NIH, had decided to create a department of bioethics. I jumped at that chance to be part of it and went over when it first started, and it was very tiny, and stayed for 27 years in that department. After like the first 12 or 13, that's when I became the director of that department, or the chair of that department.
And would you say there was a specific moment that made you realize this is the direction I want to take? This is my calling?
Yeah. Probably a series of moments, not a specific. I mean, I certainly, I grew up in an era when women in the United States had fewer options than they do today, in terms of careers. So no one in my family was a nurse or a doctor or a healthcare provider of any sort, but I had this notion that that would be a good thing for me because I loved science and I loved the idea of being able to work with people and help people. So I went to school to be a nurse. I loved being a nurse, and I learned a ton about life and death and, everything in between. I also can name a few specific episodes in my jobs as a nurse, where things sort of came to my mind as like, wow, this is something sort of confusing here about what to do. So I'll give you just two examples. I worked at Tufts New England Medical Center in the 1970s, and it was on a actually NIH-funded clinical research unit where we were doing experimental bone marrow transplantation at a time when that was a very new thing. And we had many adults and children who had very serious illnesses, leukemia and aplastic anemia predominantly. And they underwent this experimental transplant. They had to be inside of uh, what we called then the Life Island, which was this big plastic tent. And the person that was being treated was inside the tent. And when we were taking care of the people in that tent, it was like there was no human contact. Everything went through gloves or plastic or sterilized items that we would put in and out. But it was a very intensive, they were very ill, and it was a very intensive time. So it often took 2 nurses to take care of each patient. And for months, they were sick for months. I realized at some point that the amount of attention and resources we were providing for these patients, as important as it was for them, seemed disproportionate to what was happening in the world around me. So I lived in Boston, and I knew that there were people down the street who couldn't get prenatal care or couldn't get basic kinds of health care. And I thought, that doesn't seem right. How do we make these decisions about where we allocate our resources, how we spend our money, how we spend our energies? So at that point, I did go back to school for a master's degree in community health because I thought, you know, I needed to sort of figure out how to put these things together. Later, I had the opportunity to work for Project Hope in Brazil, in Northeast Brazil. And it was a very large university hospital a federal hospital that drew patients from the entire state. And it was small, in Brazil's context, a small state, but a poor, very poor state. And so lots of people with very advanced illnesses and sometimes very unusual illnesses, but they would, find ways to get themselves to the hospital. And the hospital had limited resources to take care of them. So it was always not only a question about, again, how we globally, but also institutionally allocate resources, but also how we make decisions about who gets priorities, who should get treated when not everyone can. Those were really hard questions for me when I was in Brazil. And then when I came back to the States and started working at the NIH and HIV had arrived, here I was working with young, mostly men who were more or less my age, could have been my brother or my best friend. And, at the prime of their life, struck with this terrible illness that nobody knew anything about in those days. And, trying to find ways to survive, but also to understand how to live in the world, because there still is, but there was much more then. Stigma. People were afraid of people with HIV. Sometimes their families didn't even continue to accept them. So there was this tension between what individuals needed and what other people thought they needed or thought they should get. So, I mean, those kinds of questions, I was like, there's got to be a way to think about this in a sort of systematic or logical or rational way. And that's what I thought bioethics would do for me, would give me those kinds of tools. And it did. I mean, I think I have used the tools that I've learned, not only by going to graduate school, but by practicing bioethics and studying bioethics for many years. The tools have been very valuable for understanding. I mean, not that anything's solved. There's still a lot of complications in healthcare, but I've learned a lot.
You worked across countries. You mentioned Brazil. You also worked in Uganda, so international HIV vaccine trials. How did working across borders shape you as a leader and as an ethicist?
It's an opportunity. It's a privilege, actually, to be able to go to other places in the world and even other places in the country and understand or begin to be exposed to and try to understand, that culture and context makes a huge difference in terms of how people live, what people find valuable and important, how they think about health, how they deal with their health. So it was a privilege for me to be able to do those things. I went to Brazil, as I mentioned, as a nurse and worked in a large hospital in the northeast of Brazil. And I learned so much about, well, health issues that are prevalent there, but also about, people's strength and resilience and ability to face difficult issues even when they have minimal resources. Later on, as part of my job in bioethics, um, I had the opportunities to travel to many places, mostly in Africa, but also in Southeast Asia and a little bit in South America, to run workshops on research ethics and healthcare ethics, and got to meet many, many um, healthcare providers and researchers around the world. And in some of those trips, I was able to also connect with the people on the ground and like go to the hospital, visit the hospital, because for me, it was very helpful to see and to, experience in a very transient way, really, what it was like to be taken care of in the hospital in Uganda, for example, or in Malawi. So I really appreciated those opportunities as well to learn. And it just opens your eyes, it opens your eyes to the world is a big place, but it's also a small place. I mean, we need to spend as much time as we can trying to be global citizens and to understand each other and to figure out ways to, you know, be a global community. And we're not doing too well on that count right now. But
Yes, thank you. You've also written and spoken about moral distress, especially among nurses and clinicians, for women listening who feel more pressure in their own workplaces. How do you define moral courage and how do we strengthen it?
yeah, great question. So, moral distress is a description of a phenomenon that was first described among nurses. And the idea of it is that um, when you are in a situation where you think you know the right thing to do, and for some reason you can't do it or it isn't done, sometimes you don't have control over it. Sometimes it's authority, but sometimes there are all kinds of other constraints. My own view is that, what I know best is healthcare, right? So in healthcare, um, there are constantly decisions that people have to make every day decisions about, what to do in this particular situation, and in the context of often multiple people's values coming to play, the patient's values, the other healthcare team members' values, the societal values. And they don't always agree. They don't always converge. And in a healthcare environment, not always, but often there's time sensitivity. There's also emotional overlay. So there's a lot of things going on in a context of healthcare, which make it almost impossible that anyone ever makes a decision by themselves. And I'm talking about healthcare providers now. Whenever there's a decision made, they certainly can think about, this is what I think should be done. If their team agrees, if the patient agrees, if the family agrees, if the hospital lets them, if the healthcare system lets them, then they can do it. That's not always the case. There are often disagreements about what is the right thing to do. There is also often competitive arguments about why something else is important or right. And so I hope I'm making myself clear, but moral distress is a very common phenomenon among healthcare workers across the board in healthcare facilities and healthcare in general. I actually think it's not unique to healthcare. I think it's a kind of tension that people probably feel no matter across a wide variety of professions, but when they work in complex organizations, when they work with other people or with teams of people. So it's a phenomenon that's prevalent and can be very damaging, but my own view about it is it doesn't have to be damaging. And this is where we come up with concepts like moral courage or something else that I like to call moral strength. And basically, it's a different kind of, so moral strength is a different perspective where have a sort of steady sense of who you are and how you fit into an organization and what your particular role is. And you work with the community of people that you work with towards a common goal and come to terms with the things that you can do. Never giving up your integrity, never giving up what you think is right, but being able to understand the other's perspective, being able to make decisions that sometimes feel maybe not perfect, but good or good enough. And that's something that I think a lot of healthcare providers actually can do and do. Moral courage. Some people think of that as moral courage. I think that as moral strength. I would go moral courage like one step up, if you will, that there are situations, many situations where in order to act or to voice your concerns, you take a risk. You take a risk of either your own career, your own reputation, your own job. There's a lot of things that could be risky, but you do it anyway because you think it's the right thing to do. And healthcare providers also do that all the time. There are, situations where, somebody asks you to do something in a complicated healthcare setting and you think it's wrong. You have to be able to say, I'm sorry, I can't do that. And that has to be okay. So where do you get the strength and the courage from? I think a number of sources. Again, what I know about is healthcare. So I'm talking about healthcare primarily, but as I said, I think this happens outside of healthcare as well. But I think there's several things. I mean, one is I do believe most people are good to some degree, if not the majority of them or the majority of people. Secondly, I think the motivation to become a healthcare provider is to help people. It's to do something good. It's not to be rich and famous. I don't think most people are not. Third, I think there is definitely a role for education about ethics and education about right and wrong, which is something that should start in childhood. But as you get older and you get into a professional setting, there needs to be very specific education about how to deal with ethical considerations. I think the team of people you work with matters a lot. The degree to which you can talk to them and voice your own concerns and opinions without feeling fear of retaliation or disrespected or dismissed. I think the institutions that you work in matter, or the systems that you work in, because they have certain values and certain priorities, and they should, if in my view, support the common good or the common goal that the healthcare providers are trying to achieve, and do so by not only putting structures in place that are good for the people they are taking care of, but for those who are taking care of the patients. So all of those things matter in terms of giving healthcare providers the strength and the courage to do the job they do and to minimize the amount of distress that they might experience.
Thank you. With that said, your career has taken you into rooms where the stakes are enormous, from the White House Commission to NIH policy. Did you ever face moments of self-doubt, and how
Hmm.
did you navigate them?
I would say probably every day. And I still do. Like many people, I think I suffer from imposter syndrome, thinking, I know some things, but I don't. I'm not always the smartest person in the room or the person that knows the most. So it is easy to give way to self-doubt. On the other hand, I would say that, part of what has gotten me through life to this date, and I'm getting old, so is that I have been lucky to be involved in things that I care about. And when you care about something, you do your best to make it, you bring what you know to the table, you bring what you can do to the table, you admit when you don't know something, you work together with other people. I mean, and there's something about that. I notice it in people. I notice that there's some people who don't seem to have it. It's this like desire, uh, care about the goal, care about the process, and a desire to do the best you can to get there. And I think that can counter any self-doubt that you have, that anyone has. I mean, all of us have skills and all of us have knowledge that we can contribute. And we can also continue to learn and develop more. we have to use it. We have to know how to use it in any situation that we're in.
Yes, definitely. I was once told self-doubt and being nervous about things is actually a good thing because
Hmm.
you care about those
Yeah,
things.
yeah, I agree with that.
You've won mentoring award at the NIH. What do you think women need most from mentors, and how can they become mentors for others, even early in their careers?
Yeah. So I've been very fortunate to have the opportunity to mentor a number of fellows over 30, almost 30 years now, at the NIH. And our fellows are postdoctoral fellows, people who have just finished a PhD or an MD or a JD, and also post-baccalaureate fellows, so people who have just finished their undergraduate education and are coming to us for a couple of years before they go off to something else. It's been an amazing opportunity for me because I learn a lot from working with fellows. My approach to mentorship is that, the most important thing is that I want them to succeed, that I want to find ways to help them develop their career identity, develop their career pathways, find opportunities to do things that they care about, find ways to build their careers, in the short term that I'm with them, but also for longer term. And also to care about them as people because, nobody is just their job. There's so much that goes on in people's lives and it impacts, of course, their work. Um, but it also impacts their happiness and their mental health. So the people that I've had the opportunity to mentor, I feel very close to. Some of them I feel like almost like my children. And at least because of the situation I've been in, I'm able to keep in contact with most of them as well. I mean, they sort of graduate from our fellowship and go off and do great things. Some of them are leaders in the field now, but I still see them. I still talk to them. I still care about them. And you asked specifically, Margaret, about women. I mean, both men and women need good mentorship. I think sometimes women are less willing to ask for what they need than men are. And that's something that a mentor should be aware of and try to elicit, if that's the right word, because everybody has needs. The second thing is there sometimes are things that women are doing that, like having babies, for example, that sometimes take them out of the pathway for a little while. And, that should be celebrated, not seen as a distraction or a negative in any way. So I think as mentors, we have to be really sensitive to the person that we're working with or persons that we're working with and what their particular situation is, what their particular needs are, and how to help them succeed in life the best that they can.
Thank you. Um, let's talk a little bit more about bioethics. For people who are listening and who aren't familiar with bioethics, how would you describe what bioethics really is and why it matters?
Okay. So technically, bioethics is a branch of moral philosophy. So moral philosophy meaning the branch of ethics. And, ethics is about, in general, is about how should we live? How do we act towards each other? How do we, become good people in the world? How do we take care of the world? I mean, there's a lot of big questions that ethics has always addressed. Bioethics is asking some of those similar questions in the context of healthcare, health research, public health, healthcare delivery. So it's asking the similar questions. So one of the things that's really important about bioethics is it's a discipline that it's an inquiry. It's an inquiry into the right way to do things, into the right way to think about things, into the right way to be into the characters that we want to cultivate. And it's an inquiry that then leads to scholarship and policy, but also bioethics has an important practice, and that is helping other people at times when they're in difficult situations. So that is primarily in bioethics, that's primarily like patients and families and clinicians in hospitals or other healthcare facilities where they come up with a question that's difficult to answer or a situation that's hard to resolve. And they might need someone with some bioethics thinking to help them think it through. But it also could be the practice of bioethics, I think, is also very useful for policy because developing policies that take into account ethical considerations about how we ought to be thinking about the impact on people or the reason to do a certain thing, to do things right. That is part of bioethics too. So I sort of wandered, but the main thing is what's the right thing to do in a given situation? How do you be a good person or how do you be a good healthcare worker? How do you be a good researcher? How do you be a good public health official? And how do you treat others? And I don't mean treat by like giving them medications or surgery, but I mean interact. How do you care for others? How do you treat others when you're dealing with them? Those are the important things that bioethics deals with. And I will say that I say that, and I think that's right. But I also think, some people think of bioethics and they think of, cloning and medical assistance in dying and, I don't know, other big emerging technology kinds of things. Those are really important technologies and emerging issues that bioethics does care about. But what we care about in the context of those is what are the reasons we should or shouldn't clone somebody? What are the reasons that medical aid in dying ought to be available or ought not to be available? Who should it be available to? What kind of criteria should be used to decide when it's used? What are the potential abuses and are they being acted on? And so those are all questions about, the right way to do something, but they are in the context of some very high tech or cutting edge issues in our society, in our world. Does that make sense?
Yeah. Yes, thank you. Very interesting, especially the cloning and these kind of questions.
Yep.
That would be my next question. Um, what ethical questions around AI, for example, or neurotechnology or genetics keep you up at night?
Keeps me up at night too. Well, there are lots of them actually. I mean, I think to be perfectly honest, there are things about AI that I don't fully understand, and the capabilities of AI, I think, are evolving as we speak. So, what it can and can't do, what it can do already is pretty mind blowing, and it's probably going to get more powerful as time goes on. So, what do I worry about it? I worry about its misuse. I worry about people using AI to think and then leading to us as human beings not thinking much anymore or not challenging ourselves to think or analyze. I worry about that. I worry about AI taking away some of the relational aspects of life. Talking to or being cared for by a chatbot might cover the basic needs, but there's something missing in that equation to me in terms of the relationship, the human relationships that sometimes can be messy and difficult, but they're so valuable in so many other ways. I worry about the standard things that people worry about. Bias, AI, AI is created on information that's already biased, and it can and it is perpetuating some of that bias and perpetuating some of the inequity that comes from that. I worry about that. I worry about privacy. We're living in a world now where again, in healthcare, for example, there's this thing called ambient AI, which is you go into a hospital, a clinic room to see the doctor, and rather than having somebody take notes, it's being recorded, and AI is doing the recording. So everything you say, everything you do, is being recorded. So privacy is, who knows what that means in terms of privacy. You asked about neurotechnology too. So neurotechnology has some similar concerns. There's some incredible advances in neurotechnology that are going to help people, for example, with speech disorders, but also lots of other neurological disorders. So, for example, there was a study that was done recently or published recently. A patient with ALS who has been working with a brain computer interface with the researchers, which allowed him, with lots of training and lots of, iterative refinement of the technology, to be able to think his thoughts and the computer will speak it for him. And they've even been able to make it sound like his own voice. So this is a person who's been robbed of speech because of the disease that he has, but now a computer, if he's hooked up to the electrodes and he just has to think it, a computer can put words into, out there for him, and his family and others can hear it. So that's an incredible accomplishment. But it also gets you start thinking about, okay, if a computer can be taught to read what I'm thinking, then maybe there are things I'm thinking that I don't really want to say. The computer has to either be programmed in a way that that distinction can be made, or all of our thoughts will become available. Now, it's going to be, scaling up this kind of thing is a huge problem. This is one person. There's been a handful of people that have had these BCIs and have been able to do this kind of thing. But, neurotechnology is pretty exciting, but also raises these really interesting questions about, how important is our brains to who we are and how we think and how we live in the world, and how much do we want the world to know about what's in our brain, and how much control do we want over it?
You worked through some of the most challenging ethical periods in modern medicine. What patterns do you see in how societies respond ethically during crisis? And what gives you hope?
So as I mentioned earlier, I worked in the early days of HIV and worked for a long time with people who had HIV and doing some HIV research and thinking about the ethics of HIV research and the ethics of HIV care and all that kind of stuff. I also worked not directly with Ebola patients, but we worked through some of the issues that came up when Ebola was a huge problem in West Africa. I know it's been a problem in other countries for many years and continues to be a problem periodically around the world. And in the last 5 years, I've, 5 years ago, started working with issues related to COVID. So, what have I learned from them? So, a couple of things, and what gives me hope. I am mostly hopeful because of the people that are able to both live with these conditions, but also help others live with them. So, what I mean by that is when I worked with HIV patients, one of the things that was so striking to me is how brave they were, how brave and how strong, and how hopeful they remained sometimes in the face of some pretty awful symptoms and life prospects. But they were strong, and even close to death, they showed their strength, and that's an amazing thing to witness and to learn from. You learn, the 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 strength and resilience of people is pretty remarkable. And I saw that during COVID as well, that, there are both the patients, but also the providers that were working during COVID, working, endless hours with way too many patients to take care of and lots of lonely and hard death. But they kept coming back. They kept coming back because they knew that somebody had to take care of the patients, and they would come and they would do it. And so and did it well with care and with, competence. I think that kind of strength and resilience is something that gives me hope, because we're all living, the world is a mess at the moment, but not just health crises, but other kinds of crises. There are good people out there. There are strong people out there. There are resilient people out there. There are people who care about what's going on and what to do and how to do it well. And that's what gives me hope. And young people who are really see a better world, have a lot of energy and good ideas, and are willing to work for it.
Thank you. In the past years, we've seen mistrust in science rise. In your view, what truly builds trust, especially across borders, cultures, and inequalities?
Yeah. I think actually what builds trust the best is person to person contact. That when people really talk to each other and get to know each other and relate to each other or do things together or work together, they begin to trust each other. It requires a person to be trustworthy. In other words, to be honest and real about what they're doing, in order to develop that kind of trust with person to person contact. But I think the person to person contact is such a critical part of how you get to trust people. And it's a very important thing for our world, because one of the things I'm quite worried about right now is the tendency towards isolationism. And I think that's bad for trust. It's bad for security. It's bad for good relations. It's bad for health reasons. I mean, it's bad for so many reasons. I just wish we could do something about that. But that's kind of where we are at the moment. I do think I'm worried about what I was saying before about, some people have to be they can't be disingenuous, because then trust gets destroyed. And what's happening in the world right now is that there's a lot of disinformation, misinformation, but also disinformation, meaning deliberate information to try to mislead people. And that, I think, creates a situation where people don't know who to trust or how to trust. They don't know what to trust, because there's so much information out there that's not evidence-based. And, to work against that is something that we all have to do.
Thank you.
Yeah.
Um, yes, and when we talk about purpose, when you think of your purpose today, not your necessarily not your job title, what do you feel your work is really about?
Yeah. It's a great question, especially actually for me right now, because I have been pushed out of my job. I am no longer at the NIH, and after many decades actually there. And some of that was all political. So it's all political. But what I have been asking myself since then is, what is my purpose? What is my purpose in life? And I think, with a job or without a job, I feel like part of what I can do is continue to study and address the hard issues that many people are facing. Many of many of which are maybe all, maybe not all, but most of which I would call bioethical issues, but maybe not all of them. But I mean, I have some of those skills I've cultivated over many years. I can study, I can analyze, I can talk to people, I can present things to people. And I think my purpose is to continue to provide that kind of, where it is, knowledge, wisdom to people. And that could be, and it's interesting because, the question is, in what venue? It could be, talking to you. It could be talking to my neighbors. It could be teaching my children. It could be giving a talk at a national conference. It could be, there are lots of, it could be writing. There are lots of ways that I think I can achieve that goal of trying to help people with thinking through, understanding, thinking through, and helping to address hard questions that are prevalent.
Well, it's definitely inspire as well, because through this podcast, I think you're gonna inspire so many people and so many women who are maybe in the field or maybe are even interested in this topic. So yes, thank you. Thank you very much for that.
You're very welcome. I'd love to get more women involved in bioethics. I'd love to get more women involved in healthcare. I mean, around the world, not just in the United States.
Let's talk a little bit about resilience. As you've seen suffering across countries, crisis, pandemics, ethical dilemmas. How do you stay grounded and hopeful?
Yeah. Well, I think it goes back to something we discussed earlier that, there's a strength in people. Some of it is moral strength, but some of it is just strength, that people have to be able to deal with adversity and to be able to deal with difficult situations. Sometimes they need help. There's somebody said a sign of seeking help is a sign of strength, and I think that is true. Sometimes you need help and you need to know when to ask for it. But I think with the right kind of help and the right kind of attitude to start with, people are quite resilient. They are able to be resilient. They're able to, you know, come back from diverse adversity and, you know, find the strength that may have been attacked by the adversity. But they need community for that as well. And I think women in general are very good at developing and sustaining communities, small and large, but they're really good at it. And we should really focus on doing that as much as we can, because I do think it's a critical element of being able to be resilient when something happens. And I don't know if women do it naturally, but they certainly do it better than others.
Definitely. I can
Yeah.
only agree as I see it firsthand building this community. I can really see um, that there's a huge purpose in building something together, having a community that's for with like-minded women. It
Yeah.
really brings something more to your day-to-day life. And if you could speak to these young women listening and all the global citizens building purpose-driven lives across borders, what is one piece of advice you wish someone told you earlier?
Well, I'll give you two pieces of advice that maybe I would or would not have listened to earlier, but I think they're both true. One is, and people say this all the time, but I think it's absolutely true. Find something you care about. Find something you feel passionate about. Now, that passionate and that caring isn't going to be linear. You're going to someday say, oh my gosh, what am I doing? It's so important to find something in your life that you care about and that you can then dedicate your energy and your thought processes and everything to. A second thing is be willing to pivot. Be willing to take opportunities as they come to you. So don't think of, I'm 20 years old today. I'm going to plan the rest of my life and it's going to go like this. You can't see a line, but very rarely does that happen. Opportunities present themselves to you along the way, and you get a choice, usually, not always, about taking them or not. I think in my life, I've had wonderful opportunities, and I think I've always been the kind of person who's saw an opportunity and was like, "Whoa, that sounds really interesting. I think I'm going to try that." And it's worked for me. So I think it's not going to work for everybody, but it is. It's a really don't expect everything to be linear. Be willing to go with the flow, so to speak, or take on opportunities when they arise. And then the third piece of advice, I said two, but I have a third one. The third one is keep people around you that can support you. Now that whether that's community, a network, whatever, family, friends, both, make sure you have people, because people really matter in terms of being able to have purpose, be resilient, move forward, and make a difference in the world.
Thank you so much for joining us today, Dr. Grady, and for sharing your insights and experiences. And to our listeners, thank you for turning to Women Beyond Borders podcast, a space where we celebrate women creating impact across borders, cultures, and causes. If you enjoyed this week's episode, don't forget to follow the podcast and share it with someone who would find it inspiring. Until next time, let's keep building bridges and making impact together.
Thank you, Margaret. Thank you very much for the opportunity.